Hi everyone, so today we are going to learn about foramen of norma basalis. We have seen the anatomy of norma basalis in three different parts: the anterior part, the middle part, and the posterior part. Now today we'll be seeing all the foramen which are present in norma basalis and the structures which pass through them. Today we'll be learning that. So in the anterior portion of anterior one third of norma basalis, three important foramen are present. First is the incisive foramen. This is the incisive foramen. Then second is the greater palatine foramen. Here, as we can see, is the greater palatine foramen, and this one is the lesser palatine foramen. Then after that, we'll come to the middle one third of norma basalis. So in that, there the foramen which are present is the foramen ovale. This oval shaped foramen is foramen ovale. Behind that, there is presence of foramen spinosum. In front of foramen ovale, th- one more foramen which may or may not be present is called as emissary sphenoidal foramen, and between foramen ovale and foramen spinosum one more foramen might be present in few people, which is called as canaliculus innominatus. So this is foramen spinosum, this is emissary sphenoidal foramen or foramen of Vesalius, and last is the canaliculus innominatus. After that, other foramen which are present in middle part of norma basalis are this is sulcus tubi. This is not a foramen. It is a sulcus like groove which is present between the sphenoid bone and the petrous temporal bone. This is called as sulcus tubi. And this is foramen lacerum, the carotid canal. This foramen which is present in the petrous temporal bone is the carotid canal. Then jugular foramen. Here, between the petrous temporal bone and occipital bone, there is presence of a foramen in the medial end. This is called as jugular foramen. Hypoglossal canal, which is present in the anterolateral border of foramen magnum, here and here, both the sides, is called as hypoglossal canal. Then condylar canal, which is present posterior to the occipital condyles, foramen magnum, mastoid foramen or sphenomastoid foramen. Now this is the mastoid canaliculus, the cochlear canaliculus, and tympanic canaliculus. Mastoid canaliculus is present at the lateral end of jugular fossa. The cochlear canaliculus is present in the medial end or the anterior most part of the uh, occipital bone, and then tympanic canaliculus is present between the jugular fossa and the lower end of the carotid canal here. This is the tympanic canaliculus. So now we'll see each foramen in detail. First is the incisive foramen. So in the anterior one third of norma basalis, the most anterior foramen which is present is called as incisive foramen. It is also called as nasopalatine foramen or anterior palatine foramen or Stenson's foramen. So this foramen is present in the anterior most part of the hard palate in the midline, behind the two central incisor teeth, two maxillary central incisor teeth. There is presence of a foramen behind that, which is called as incisive foramen. So this is a single foramen which provides entry point for two canals. Foramen is single, but two canals take the entry point in this foramen. This foramen in oral cavity is covered with a bulbous fold of mucosa, which is called as incisive papilla. So the structures which pass through incisive foramen are the branches of nasopalatine nerve. So it provides the passageway for the branches of nasopalatine nerve. Nasopalatine nerve is a branch of maxillary division of trigeminal nerve and terminal ends of greater palatine vessels. And the terminal ends of greater palatine vessels. So the clinical significance of incisive foramen is in patients in which there is presence of atrophic maxilla, and implant has to be placed in anterior region of maxilla. Then the location of nasopalatine foramen has to be kept into consideration. Then next is it is a potential site for cyst formation, which is called as nasopalatine duct cyst. It is a developmental cyst. So It is present in the anterior maxilla behind the central incisor teeth, which is oval or heart shaped in a heart shaped cyst. It can be developed in nasopalatine foramen, and second is lastly it is the site for local anesthesia. So whenever there is any surgical procedure which have to be done in the anterior maxilla, the nasopalatine nerve block is given. So this is the incisive foramen or nasopalatine foramen. Next is the greater palatine foramen. So this greater palatine foramen is present in the posterior part of hard palate, posterior most part of hard palate on both the sides. So it is usually present between the junction of maxillary bone and palatine bone. So this is the palatine process of maxillary bone, and this is the these two are the horizontal processes of palatine bone. So on the suture which is present between the maxillary bone and palatine bone, there is presence of this greater palatine foramen. It is usually present behind the third molar teeth. Then the structures which pass through greater palatine foramen is greater palatine nerve, which again is the branch of maxillary nerve, maxillary division of trigeminal nerve. And second, it's this greater palatine nerve supplies the hard palate, the gingiva, and the glands of the palate. And lastly, there's the greater palatine vessels, which pass through greater palatine foramen. The significance of greater palatine foramen is that this also is a site of local anesthesia whenever there is a procedure in the posterior part of the maxilla. I have to, any procedure of the posterior part of the maxilla for anesthetizing palate, greater palatine nerve block is given. So this is the site for local anesthesia. And then it is also important uh, to be considered whenever there is any hemostatic procedure or treatment of neuralgias. Then after that we come to lesser palatine foramen. So this is the greater palatine foramen. Behind that there is presence of another foramen which is called as lesser palatine foramen. It is usually present where the pyramidal process of palatine bone joins the horizontal plate of palatine bone. So at the junction of horizontal plate and the pyramidal process of palatine bone, there is presence of a foramen which is called as lesser palatine foramen. It might be single foramen or there might be presence of 2 to 3 foramen. So the structures which pass through lesser palatine foramen are lesser palatine nerve and lesser palatine vessels. So lesser palatine nerves, they contain sensory fibers and as well as parasympathetic fibers to the soft palate glands, and also they transport special taste fibers from soft palate via facial nerve. And lastly, there is presence of lesser palatine vessels which supply the soft palate uvula and tonsils. So blocking the lesser palatine foramen, it can provide excellent pain relief in surgical procedures involving palate. Coming to middle part of norma basalis. So here there is presence of a large oval foramen which is called as foramen ovale. It is present in the middle cranial fossa on the greater wing of sphenoid. So this is the posteromedial border of greater wing of sphenoid. Along the posteromedial border of greater wing of sphenoid, there is presence of foramen ovale. So this is its anatomic location. Then coming to the contents of foramen ovale, the contents of foramen ovale is mandibular nerve, which is a branch of trigeminal nerve, then accessory meningeal artery, lesser petrosal nerve, which is a branch of glossopharyngeal nerve, and emissary vein. These four are the contents of foramen ovale. And the clinical significance is that it is a key anatomic landmark in procedures involving treatment of trigeminal neuralgia, such as rhizotomy or biopsy procedures. After that, we will come to foramen spinosum. This is the smaller foramen which is also present in middle cranial fossa on the greater wing of sphenoid or along the posteromedial border of greater wing of sphenoid. It is present posterolateral to foramen ovale. So this is foramen spinosum. The contents which pass through foramen spinosum are middle meningeal artery. Middle meningeal artery is a branch of maxillary artery, which in turn is a branch of external carotid artery. So it is crucial for supplying dura mater and the inner part of the skull bones. And second structure is meningeal branch of mandibular nerve, or which is also called as nervus spinosus. It supplies the dura mater of middle cranial fossa. Along with that, it also supplies the mastoid ear cells and cartilaginous auditory tube. And third structure is posterior trunk of middle meningeal vein. Then this foramen is the site for epidural hematomas in cases of skull fractures. So this is foramen spinosum. Next foramen is emissary sphenoidal foramen or foramen basalis. This foramen is present anteromedial to the foramen ovale. It may or may not be present. So it is not always present. Emissary sphenoidal foramen, it may or may not be present. So this foramen, it is present anteromedial to foramen ovale, also in the sphenoid bone. Then the content of this emissary sphenoidal foramen is emissary vein, which connects the pterygoid venous plexus to cavernous sinus. So because of this connection, it can be a site for transmission of extracranial infections, which may reach to cavernous sinus through this foramen. So this is emissary sphenoidal foramen. It contains emissary vein connecting pterygoid venous plexus to cavernous sinus. Next is canaliculus innominatus. There is another foramen which may or may not be present between foramen ovale and foramen spinosum. This is called as canaliculus innominatus or foramen petrosum or foramen of Arnold or petrosal foramen. So this canaliculus innominatus contains lesser petrosal nerve. Lesser petrosal nerve goes to infratemporal fossa through this foramen. So this is a lesser petrosal nerve, as we have already seen, as a branch of glossopharyngeal nerve. Usually it passes through foramen ovale, but whenever there is presence of canaliculus innominatus, lesser petrosal nerve passes through this foramen. It carry parasympathetic nerve fibers to the parotid gland, and this foramen is crucial in neurosurgical procedures near skull base. So lesser petrosal nerve is its content. Next is foramen lacerum, or it is also called as lacerated foramen or torn foramen. Foramen lacerum is present between the greater wing of sphenoid, the petrous temporal bone, and basi-occiput or basilar part of the occipital bone. So it is anteriorly, it is bounded by greater wing of sphenoid. Posterolaterally, it is bounded by petrous temporal bone, and posteromedially, it is bounded by basi-occiput. So this foramen, it is this foramen lacerum, the structures which it contains are, so foramen lacerum in living people, this inferiorly, this foramen lacerum is completely filled by cartilage. This is the portion of foramen lacerum. This is petrous temporal bone and this is sphenoid bone. In between, there is presence of this foramen which is called as foramen lacerum. In living people, this foramen lacerum is completely filled with cartilage. So only two structures are there which traverse the whole length of this foramen lacerum, which is, first is the emissary vein which connects the cavernous sinus to pterygoid plexus of veins, and second is the meningeal branch of ascending pharyngeal artery. So only these two are the structures which traverse the whole length of foramen lacerum. Now in this petrous temporal bone, there is presence of carotid canal. So this carotid canal runs in the length of petrous temporal bone, through which internal carotid artery passes. So this structure is the internal carotid artery, and this internal carotid artery is just surrounded by sympathetic nerve plexus and also the venous plexuses. So this internal carotid artery, it goes through the carotid canal and it reaches the upper part or the superior part of foramen lacerum. It does not traverse the whole length of foramen lacerum, but it goes through the superior part of foramen lacerum and reaches the middle cranial fossa. Here is the middle cranial fossa. So this is the internal carotid artery. So in the contents of foramen lacerum, we can say that in the superior part, internal carotid artery is present, but it does not traverse the complete length of foramen lacerum. Then this one is the greater petrosal nerve. This greater petrosal nerve, it comes downwards in the anterior aspect of foramen lacerum here, and it joins the deep petrosal nerve. This one is the deep petrosal nerve which comes out of the sympathetic nerve plexus which is present around the internal carotid artery. So this deep petrosal nerve, it runs down from the sympathetic plexus around the internal carotid artery and joins the greater petrosal nerve, and then forms the nerve of pterygoid canal or nerve to pterygoid canal, and goes into the pterygoid canal, which is present in the sphenoid bone. So in the so we can say that two structures which traverse the whole length of foramen lacerum are the meningeal branch of ascending pharyngeal artery and emissary vein, which connects the cavernous sinus to the pterygoid venous plexus. Apart from that, the contents of foramen lacerum also include the internal carotid artery along with its sympathetic and venous plexus in the superior part of foramen lacerum, and also the greater petrosal nerve, which joins the deep petrosal nerve in the anterior aspect of foramen lacerum to form the nerve of pterygoid canal, and then this nerve goes into the pterygoid canal. So these are the contents of foramen lacerum. So the main contents which traverse through the foramen lacerum are two: meningeal branch of ascending pharyngeal artery and emissary vein from cavernous sinus. But other structures which are present there are the internal carotid artery along with its sympathetic nerve plexus as well as venous plexus, and greater petrosal nerve, deep petrosal nerve, and nerve to pterygoid canal. The next canal is the carotid canal. So this one is the carotid canal. It is present in the petrous temporal bone. This is the posterior part of carotid canal, and somewhere here is the anterior part of carotid canal, which opens into the middle cranial fossa in the internal surface of the skull base. So this is the carotid canal. The contents of the carotid canal are the internal carotid artery along with its venous and sympathetic plexus. So this is the external opening or inferior opening of the carotid canal, which is present immediately anterior to jugular foramen, and this one is the superior or the internal opening of the carotid canal, which is present posterolateral to the foramen lacerum. So this carotid canal is approximately 2 centimeters long, and it contains internal carotid artery along with its venous and sympathetic nerve plexuses. So stenosis or aneurysm within this canal are major stroke risks. This is also an important surgical landmark in any procedure involving the base of the skull, and it is also crucial to evaluate during skull fractures. The internal carotid artery, venous plexus, and sympathetic plexus. Next is the jugular foramen. This jugular foramen is located So the jugular foramen is located between the petrous part of temporal bone and occipital bone. So this is the jugular foramen. It is located between the petrous part of temporal bone and the occipital bone. It contains glossopharyngeal nerve, vagus nerve, spinal accessory nerve, then sigmoid sinus, which becomes internal jugular vein, internal petrosal sinus, and internal jugular vein. So, and posterior meningeal artery also. So this jugular foramen is somewhat like this. There are two parts of this jugular foramen. One is the pars nervosa, and next is the pars vascularis. So this pars nervosa and there is presence of a jugular notch and jugular spine, which divides this jugular foramen into two parts. One is the pars nervosa, which contains glossopharyngeal nerve. This is the ninth cranial nerve or glossopharyngeal nerve, and also the inferior petrosal sinus. This is the inferior petrosal sinus. And this whole part is the pars vascularis, which contains the vagus nerve. This is the 10th cranial nerve or the vagus nerve, spinal accessory nerve. This is the 11th cranial nerve, and also the auricular branch of vagus nerve is also present here. Apart from that, this sigmoid sinus along with internal jugular vein is present. This is called as jugular bulb, or the initial part or the primary part of the internal jugular vein, where basically it starts. This is called as jugular bulb. So this is present in the jugular foramen, and apart from that, posterior meningeal artery. So this is meningeal branch of occipital artery, and this is meningeal branch of ascending pharyngeal artery. These two arteries are also present, also pass through jugular foramen, and few emissary veins are seen here. So this is the structure of jugular foramen. Here is the presence of inferior petrosal sinus. There is the presence of ninth cranial nerve or glossopharyngeal nerve. This part is called as pars nervosa. Then next is the pars vascularis, where there is presence of 10th cranial nerve, that is the vagus nerve, auricular branch of vagus nerve. Next is the glossopharyngeal, the spinal accessory nerve or the 11th cranial nerve. Then after that, there is presence of meningeal branch of ascending pharyngeal artery and meningeal branch of occipital artery. After that, there is presence of jugular bulb, which is the presence of sigmoid sinus, where it forms the internal jugular vein, and few emissary veins are also present. So this is the structure of jugular foramen. Next is the hypoglossal canal. So hypoglossal canal is present in the anterolateral aspect of foramen magnum, anterolateral border of foramen magnum. So this is the anterolateral border of foramen magnum, and two hypoglossal canals are seen, one on each side in this place, deep to the occipital condyles. So these are the occipital condyles. Deep to these condyles, there is presence of hypoglossal canal. This hypoglossal canal, it contains hypoglossal nerve. Hypoglossal nerve is responsible for supplying the muscles of tongue except the palatoglossus muscle. Apart from this hypoglossal nerve, it also transmits meningeal branch of ascending pharyngeal artery and emissary vein. Emissary vein which connects the sigmoid sinus to the internal jugular vein. Then the significance of this hypoglossal canal is in cases of tumor, trauma, infection. If it occurs, if it affects the unilateral canal, then there is deviation of tongue to the affected side and atrophy on that side. And if bilaterally both the canals are affected, then severe atrophy and difficulty in speech and swallowing will occur. So this is the hypoglossal canal. Next is the condylar canal. So condylar canal, there below these occipital condyles, there is presence of a fossa like structure which is called as condylar fossa, and in that condylar fossa there is presence of this canal which is called as condylar canal. So this is the posterior, or it is also called as posterior condylar canal. The hypoglossal canal is also called as anterior condylar canal, and this is called as the posterior condylar canal or the condylar canal. It contains an emissary vein which joins the sigmoid sinus with the veins which are present outside of the skull, which is also called as suboccipital plexus. So there is presence of an emissary vein which joins the sigmoid sinus to the veins which are present outside of the skull, and also there is presence of meningeal branch of occipital artery. So it is crucial for balancing intracranial pressure, as it is a bridge between the intracranial and extracranial venous system. And also there is no valves in this junction, permitting the blood to flow in both the directions. So there is the contents are the structures which pass through condylar canal and emissary vein, which joins the sigmoid sinus to the suboccipital plexus of veins and meningeal branch of occipital artery. In this junction of veins, there is presence. There any valve is not present in this junction, so blood can flow in both the directions. So it is responsible for maintaining intracranial pressure or balancing intracranial pressure. It is a bridge between intracranial and extracranial venous system. Now, the coming to foramen magnum. So, this is the largest foramen which is present in the skull base. This is oval in shape. It is anteriorly it is narrower as compared to posterior part. Posteriorly it is broader. So, this is foramen magnum. It is present in the anteromedial aspect of the occipital bone, and uh, this is the deepest region of posterior cranial fossa. The content is through this foramen magnum, the medulla oblongata, it becomes continuous with the spinal cord, along with its meninges and cerebrospinal fluid. So the contents are lowest part of medulla oblongata along with associated meninges and cerebrospinal fluid. Also, spinal accessory nerve is present in this. Vertebral artery, sympathetic plexus around the vertebral artery, posterior spinal artery and anterior spinal artery. And after that, apical ligament of dens, cruciate ligament and membrana tectoria. So this is the structure of foramen magnum. This is broader posteriorly and narrower anteriorly. Anteriorly, it transmits the apical ligament of dens. Second is the vertical band of cruciate ligament or longitudinal ligament. And third is the membrana tectoria, along with few emissary veins. So these three structures pass from the anterior part of the foramen magnum. From the posterior part of foramen magnum, which is broader, it contains the spinal cord along with its three meninges and cerebrospinal fluid. So this is the dura mater. This is the subdural space. After that, this one is the arachnoid matter. This is the subarachnoid space. And lastly, this one is the pia mater. So these are the three meninges of spinal cord. This internal structure is the spinal cord. This is the gray matter of the spinal cord, and this outer portion is the white matter of the spinal cord. Now, this in this subarachnoid space, there is presence of vertebral artery. So this one is the vertebral artery. Vertebral artery along with its sympathetic plexus. This is the anterior spinal artery. And these two are the posterior spinal. These are the posterior spinal artery. So this one is the posterior spinal artery. This is the spinal root of accessory nerve or the 11th cranial nerve. Spinal root of accessory nerve, and this is the cerebellar tonsils. Tonsils. So this is the structure of foramen magnum. The anterior part transmits apical ligament of dens, the vertical part of cruciate ligament, and the membrana tectoria. And the posterior part, it transmits the medulla oblongata, which becomes continuous with the spinal cord along with its three meninges and the few arteries and nerves in which there is presence of vertebral artery along with its sympathetic plexus, anterior spinal artery, posterior spinal artery, and spinal accessory nerve. These two are the spinal accessory nerves. So this is the structure of foramen magnum. Now, any stenosis or cerebral herniation can cause compression of medulla oblongata in this foramen magnum, medulla oblongata as well as the spinal cord. It may affect the flow of blood and cerebrospinal fluid, which can lead to life-threatening respiratory complications. So, this is the clinical significance of the anatomy of foramen magnum. Next foramen is the mastoid foramen or the sphenomastoid foramen. It is present in the mastoid part of temporal bone. It may be present in the temporo-occipital suture. It may be present here also in the temporo-occipital suture. It may be present in the occipital bone itself. So its location is not always the same. The content which goes through this mastoid foramen is the mastoid emissary vein, and anatomical variation makes it crucial to anticipate the exact location of this foramen. So this is the mastoid foramen. Next is the mastoid canaliculus. So this is the jugular foramen here. Here is the presence of jugular foramen and till here. And here there is presence of a depression or fossa-like structure in the petrous temporal bone, which is called as jugular fossa. At the lateral end of this jugular fossa, there is presence of a canaliculus, which is called as mastoid canaliculus. So a mastoid emissary vein passes through this mastoid canaliculus. This is the the mastoid canaliculus contains the auricular branch of vagus nerve. The mastoid canaliculus contains the auricular branch of vagus nerve. Then secondly, At the anteriormost end of this jugular foramen, there is presence of another canaliculus, which is called as cochlear canaliculus. So this cochlear canaliculus contains a perilymphatic duct, which connects the inner ear's perilymphatic space, which is also called as scala tympani, to the subarachnoid space in the posterior cranial fossa. So it drains the excess perilymph to the posterior cranial fossa to balance the inner ear pressure. So this is the cochlear canaliculus. And lastly, a thin bony ridge which is present between the inner surface of carotid canal and the jugular fossa. There is presence of another canaliculus which is called as tympanic canaliculus. So this tympanic canaliculus, it contains the tympanic branch of glossopharyngeal nerve, which is also called as Jacobson's nerve, and secondly it contains inferior tympanic artery. So these are the three small foramen or canaliculus which are present in the middle cranial in the middle part of norma basalis, which is the mastoid canaliculus, the cochlear canaliculus, and the tympanic canaliculus. Now, this we have as we have already seen that there is presence of this palatovaginal canal between the vaginal process of sphenoid bone. This is the vaginal process of sphenoid bone, and this is the sphenoidal process of palatine bone. So between these two, there is presence of a canal which is called as palatovaginal canal. And above this palatovaginal, so this palatovaginal canal, it contains a pharyngeal nerve, which is a branch of maxillary nerve, and artery to nasopharynx. So this contains a pharyngeal nerve, which is a branch of maxillary nerve, and an artery to nasopharynx. And secondly, between this vaginal process of sphenoid bone and the vomer bone, this is the ala of vomer. So between these two, there is presence of another canal which is called as vomerovaginal canal. So this vomerovaginal canal, it contains phenopalatine vessels and nerves. Both these canals, they connect the pterygopalatine fossa to the nasopharynx. So these two are important anatomical landmarks for surgical or endoscopic procedures involving the nasopharynx. So with this, we come to an end to all the important foramina which are present in the norma basalis and their contents. Thank you so much.